Alexis, how are you?
Hey Katie, I'm good. How are you?
I'm good. So, regarding the videos that we watched and that meeting that we watched, I just wanted to know about your impressions of the meeting, the team meeting, and how you think it went.
I think there was definitely a lot to take in. First thing I noticed was, particularly the case manager was not prepared for the meeting. She didn't really know the patient's current living situation and hadn't spoken with the parents. Obviously, that's like a huge determinant in discharge planning. So her lack of knowledge based on the patient really limited the team from making a cohesive decision. Another thing I noticed was the PT and OT kind of went back and forth and seemed to overpower each other. Um, they couldn't really come to a conclusion, which I think from a therapy perspective is very detrimental to the patient. So overall, um, it really just didn't look like the team had communicated prior to this meeting, which is kind of disappointing.
Yeah, I agree with that. I also picked up on that. And kind of going into that, I had read about an article that was published in 2018, and it was about leadership and development in interprofessional relationships. And I remember something that stuck out to me was it mentioned that a leadership role pretty much means like a designated leader, and members have to be willing to share the responsibility.
Mhm.
And that really they just need to be cognizant of the group dynamics in order to have a successful treatment outcome and kind
Mhm.
of willing to share the responsibility and being able to work with others.
Mhm.
I don't know if you read the article, but do you have an opinion on that?
Yeah, I did actually see the article, and I remember it mentioning like the full potential of a healthcare team is reached whenever each member takes on a leadership stance. It just like spoke a lot on how like patient outcomes are considerably better just when everyone is kind of aware of each other, but also like holds up that leadership across the board. Um, and again, taking responsibility, like you said. Um, so I have a question for you just based off of that. How do you think the OT could have improved her communication?
I think the OT could really improve with learning to not speak out of turn and have a little bit more respect for the other specialties and their time that they were giving. I noticed that she would give her opinion in the middle of a conversation, and I think it would be more beneficial if she would let the other specialties finish their organized thoughts and wait for the correct time for her to add her opinion. That
Mm-hmm.
way, each profession gets a chance to give their opinion on the topic and can give it without being interrupted by another profession.
Yeah,
Um,
I felt the same way. I was kind of irritated watching that because it was like every single thing that was mentioned, she had to like put her opinion with that, especially in aspects that aren't necessarily under the OT role. So, kind of in the same perspective, what were your takeaways as far as the role that you noticed from the nurse?
the nurse I noticed kind of had the complete opposite of the OT. I noticed that she seemed to be a little timid and more quiet when she was asked questions. When she was asked specifically about the limitations that the patient might experience when being discharged or mobilizing around the hospital. She was unsure of the list of limitations the patient might have or any precautions that she might have. And I think that she just needed to be more confident in what she was saying and go in with the answers that like she knows she's going to be asked. Like she's know this is something that is important for patient discharge, and she needs to be sure of what she's saying due to patient safety and getting the best outcomes available from treatments.
Mm-hmm. Yeah.
So, with those two, how do you think the team dynamic in general might affect the outcome of the patient?
So kind of like we touched on before, like I think it really goes to show that every healthcare provider must be like actively involved in the decision making, especially for this case in particular, where there's a lot of like working factors with the family and the patient's young and like there's just so much going on. I also like again, like we've mentioned, like being able for practitioners to actively listen and kind of take back and like respectfully listen and consider everyone else's opinion. And then, like you said, speak when it's appropriate after everyone's had the chance to kind of share. I also thought that the physician could have provided more structure, just considering like she kind of led the meeting off. I feel like it would have been more productive if she would have been just more like not necessarily in control of the conversation, but like, say like, okay, from a therapy standpoint, like PT, can you give us kind of like what your recommendation is right now, and then go to OT, and then kind of transition the meeting to, okay, from just like a patient care perspective, what's the case manager's opinion and recommendation along with the psychologist and so on like that. I definitely, it resonated with me. I saw this article from 2013, and it was on 10 principles of good interprofessional teamwork. And after watching the video, the one of the principles that really stuck out to me was clear vision. The patient, they had mentioned like right off the bat, like, oh yeah, the patient's ready for discharge today. But after like going through the chart and seeing the progress of the patient, clearly she's not ready to be discharged today. So there were a few providers that were like all for her being discharged immediately, and then others disagreed. So it was just like they weren't looking at the whole picture, and just across the board, like clear vision was not being obtained at this point. I don't know if you saw the article, but based off of that, like what other principles do you think stuck out after watching this video?
Yeah, I did see the article, and clear vision was really obvious to me as well. Kind of like what you were saying, the like physician herself, she should have been delegating more. Like if she was going into that meeting wanting everybody's opinion on the patient, she should have gone like person by person and asked them their opinion, and then maybe open it up for open-ended questions at the end. So clear vision, they all kind of seem to be looking at different outcomes and different discharges, and they just seem kind of unorganized. But I also found the characteristic of good communication, which we have pretty much been talking about this entire time. It's very relevant to the case. It seemed that this team didn't really communicate with each other throughout the patient's treatment, and this was the first time they were all kind of talking about the patient. I think it would be more beneficial if, like, once the PT had a treatment with the patient, they can talk to the OT and the nurse and kind of keep them updated on it. So that way everybody comes into the meetings on the same page. And I think that they could have avoided a lot of the challenges that they had noted in the meeting with this proper communication. And overall, it would have provided a better and more clear treatment plan for them and for the patient. Um, but yeah.
Yeah. Well, I think we are definitely on the same consensus. So thanks for having me today, Katie.
Sure. Great talking to you.